Good morning. Today's class is on dental biofilm, calculus, and other factors in the periodontal diseases. To go into the contents, we will be discussing about plaque and calculus separately. So plaque, we will be discussing about its definition, the classification, composition, formation of dental plaque, plaque microorganisms and growth pattern, benefits of plaque, plaque as a biofilm. Calculus, we will be discussing about its definition, classification, types, composition, formation, and to end with, we will be listing out the other predisposing factors as well. To start with, the definition of plaque according to Bowen, and this is given in your Karansa. Dental plaque is defined as clinically as a structured, resilient, yellowish-gray substance that adheres tenaciously to the intraoral hard surfaces, including the removable and fixed restorations. So generally, plaque as a whole, it is found that it is a complex microbial community. Around 10 to the power 11 bacteria is present in just 1 gram of plaque, which has distinct 500 species. So same way, you can just imagine how much amount of bacteria is present in just a small amount of plaque. Plaque later calcifies to become your dental calculus. So about this, we will be seeing it in the later classes. Plaque is also considered as a biofilm, and why it is considered to be a biofilm, we'll be again seeing it in the later classes. So to differentiate plaque from the other tooth deposits, especially materia alba is something which is soft accumulations of the bacteria and the tissue cells that lack the organized structure of dental plaque, whereas calculus is hard deposits that form by mineralization of the dental plaque and is covered by a layer of unmineralized plaque. Dental plaque and its classification. So it has been classified based on its relationship with the gingival margin as the supragingival plaque and the subgingival plaque, that is above the gingiva and below the gingiva, which is not seen. Based on its relationship to the tooth surface, it could be either the attached plaque, which is attached to the tooth area, or the unattached plaque, which may just remain in the gingival sulcus area. So based on the surface attached, it could be the tooth attached surface or it could be the tissue attached surface. So to tell again the fact, plaque is considered to be the more dangerous one than the calculus because this is the initiating factor. So coming on to the composition, plaque is composed of intracellular matrix and microorganisms. Inorganic components of plaque include the calcium and the phosphorus, and these are the organic components which are present and their sources. Coming on to the formation of dental plaque, it is divided into three stages. The stage 1 is the formation of the dental pellicle. Stage 2 is the initial adhesion and the attachment of the bacteria. Stage 3 is the colonization and plaque maturation. Likewise, you have the diagrams which represent them. We will go on with each of these stages and its explanation in the next slides. So coming on to the stage 1, that is the formation of the pellicle. So here you have once within nanoseconds of your vigorous tooth polishing, you can see that there is a thin saliva derived layer on the tooth surface known as the acquired pellicle. So this is your enamel and this is your acquired pellicle. So this everybody gets within nanoseconds of tooth polishing. So this is having two layers, that is the bottommost layer, which is little gray in color, is very difficult to remove even with harsh chemicals and mechanical treatment. And other layer, there is a thick globular layer above it. So there's a thick globular layer above it. So this layers contain that is acquired pellicle contains glycoproteins, protein-rich proteins, phosphoproteins, enzymes, and molecules that can function as adhesion sites for the bacteria as receptors. So coming on to the stage 2, where there is initial adhesion and attachment of the bacteria, bacteria can be detected within 3 minutes of introducing sterile enamel into the mouth. So in other words, within 3 minutes of a baby being born, its oral cavity is having some amount of bacterial formation. Of course, that is going to be non-pathological. They're going to be a normal flora. So over first 4 to 8 hours, 60 to 80% of the bacteria present are members of Streptococcus. Primary colonizers include the obligate aerobes and the facultative anaerobes. So this is generally occurring in your oral cavity. So if the plaque or the plaque is left behind, uh, I mean if the acquired pellicle is left behind, so it is divided into again three phases. So that is stage 2 is divided into three phases as well. So stage 2, the first phase corresponds to how the bacteria is getting transported to the surface. Phase 2, how there is an initial adhesion between bacteria and the surface. Phase 3, how there is a strong attachment, and then followed by your stage 3, that is it goes back to the stage where there's colonization of the surface and the biofilm formation. So first coming on to the phase 1, so transport to the surface. So bacteria or the may be attracted to the tooth surface by random contact, which occurs either by Brownian motion, through sedimentation of microorganisms, through liquid flow, or through active bacterial movement or the chemotactic activity. Once the microorganism comes near the tooth surface, it has the receptors on it. You can see receptors which are either triangular shaped or receptors which are having rectangular shapes. Okay, so these bacteria, when they come into contact with the receptors of the uh, dental pellicle, like for example, the adhesion receptors of which are triangular in shape will bound to the uh, receptor on the pellicle which are triangular in shape, and those which are having flat end will bound to the receptors which are having a flat end on the pellicle. So this is the way how the bacteria and the dental pellicle receptors bond to one another. So this is just an initial adhesion where it gets binded by means of weak long range van der Waals forces. So at this stage, even if you're going to brush well, then it is going to be a reversible phenomenon. That is, plaque formation will not occur. Okay, to go into the writings again. So this stage is an initial reversible adhesion of the bacterium. When it is initiated when the bacterial cell comes into close proximity with the tooth surface or the dental pellicle. Long and short range forces are acting on it, including the van der Waals attractive forces and the electrostatic repulsive forces operating at a distance. Stronger the binding at this point is, stronger binding at this point is a consequence of interactions between the bacterial adhesins and the receptors in the salivary pellicle. Okay, now coming on to the next is the strong attachment stage. So as I told you, the receptors which are triangular in shape in the bacterium tends to attach to the receptors which are triangular in shape in the dental pellicle. So this attachment becomes more stronger in the phase 3, wherein it becomes an irreversible adhesion. So, a firm anchorage between the bacterium and the surface is established. The binding between the bacteria and the pellicle is mediated by specific adhesins on the bacterial cell protein as well as complementary receptors on the acquired pellicle. So, apart from these three areas where the receptors gets attached to the salivary pellicle, there could be other receptors on the bacterium which are left free. That is, this end could be left free. So this end naturally attracts other bacteria, that is secondary colonizers we tell. So those bacteria which first comes and attaches to the dental pellicle are called as your primary colonizers. Further, if there are some certain other more bacteria which comes and attaches to the primary colonizers, they are called as the secondary colonizers. So coming on to the colonization and the plaque maturation. So as told in the previous slide, the same addition of bacteria gets done wherein the that is first the colonizers, primary colonizers are there, and then the secondary colonizers come and attaches. Like for example, so this is your acquired pellicle. So these are your primary colonizers, which are this Streptococcus species, almost all the Streptococcus species. So they have receptors which are free. So these receptors are being used for the attracting the other bacteria to each other, whereas certain other receptors on the pellicle surface gets attached to the pellicle. So in this way they form a strong community like this. By attaching to one another, they form a strong community like this. So primary colonizing bacteria adhere to the tooth surface, provide new receptors for attachment by the other bacteria, known as coadhesion. Coadhesion is the development of microcolonies to form a mature biofilm. Initial stages of coaggregation or coadhesion results in bacterial binding to the surfaces. The transition from the early supragingival dental plaque to a mature plaque like this, growing from the gingival margin, involves a shift in the microbial population from primary gram-positive organisms to higher number of gram-negative organisms. To put it in a nutshell, so once you have your gram-positive, which gets attached to the tooth pellicle when they are in a healthy status, eventually what happens is that when the disease status begins, that is when there's going to be a buildup of microorganisms, the microorganisms or the flora try to change themselves into the harmful gram-negative bacteria, which is deleterious to the oral cavity. So examples of co-aggregation, so primary colonizers and secondary colonizers getting attached is by means of cell-to-cell recognition of genetically distinct partner cell types. There could be two co-aggregations which was found in the microscopes. One is streptococci, where you can see small beads which are attached to each other. So this is attached to the center structure of actinomyces. So since this attachment is seen like a corn, it's called as a corn cob formation. So here there's another set of bacteria, that is filamentous bacteria gets, the gram-negative bacteria gets attached to the filamentous bacteria, giving us a test tube appearance, and so the name. So, subgingival bacterial species are found in the plaque. This was a study done by Sokransky and Hafiji, where they found that they had given different colors for the microorganisms which are present and according to their severity. So, the most important is the three microorganisms, that is P. gingivalis, Tannola forsythia, and Treponema denticola. So, these three microorganisms are the main agents for bleeding in gingival diseases. So if there is going to be presence of any one of these microorganisms, then gingival bleeding will be present, and because of that, there is going to be disease status which is going to increase. Okay, coming out of the experimental gingival model by Lowe. So this was a study done by Lowe on tea plantation workers, wherein in plaque-free subjects with clinically non-inflamed gingiva, he had asked them not to use brush. So plaque will slowly develop on the teeth when all mechanical plaque control agent is stopped. So without brushing, the plaque continues to develop. For the first few days, there is gram-positive cocci and rods. Eventually, after the this is for the first few days. So eventually, after the first few days, you will be having gram-negative bacteria, where the gram-positive changes to gram-negative. Within few days, there could be a mild gingivitis, which is present. So from this moment, if proper plaque control was established, and according to this study, he did establish the proper plaque control after this, and he found that the symptoms of the gingivitis disappear. So in other words, gingivitis is a reversible condition if you are able to remove the plaque control agents, plaque present. Next, coming on to the relationship of specific microorganisms to periodontal disease. The criteria by which a given microbacterial species was associated with disease historically has been through the application of cost postulates. You would have read about this in microbiology. So generally, when a healthy organism is there, and if its cells are tested, and if it contains any microorganisms, if it does not contain any microorganisms, then it means that there is no disease present because there is no causative agent. Same way, if you have a diseased rat or diseased individual also for that fact, and if in their slides, if they are able to see the suspected agents, any agent, it could be either bacteria, virus, or fungi causing the disease for the patient. So such uh, one is considered to be related to the disease. So such an causative agent must be isolated from the diseased organism, microorganism, and it should be able to grow in the pure culture. And next, the cultured agent must cause the same disease when inoculated into a healthy microorganisms. The same causative agent must be then re-isolated from the inoculated disease microorganisms. So if the four criteria are satisfied, then that microorganism is considered to be one of the main killing or one of the main agents for a particular disease. Like for example, periodontitis. If I have to sell periodontitis, there should be the microorganism should have satisfied these four criteria. So coming on to non-specific plaque hypothesis given by Loesche, however, the concept that a specific bacterial species was responsible to periodontal disease fell out of place for several reasons. First, despite numerous attempts, a specific bacterial agent was not isolated from disease individuals. If a patient is having a disease status, there will be more microorganisms instead of one single microorganism. That is the hypothesis in short. Rather, the organisms was found associated with the disease were found also in the healthy individuals. Further, in 1900s, epidemiological studies indicated that the older the individual was, the more likely they were to have periodontal disease. This led to the concept that bacterial plaque itself, irrespective of the specific bacteria found in the plaque, was associated with the disease. So this concept was known as the non-specific plaque hypothesis, telling that all bacteria were equally effective in causing diseases. But again, this was taken back by this by the one who told as well. Loesch, he gave another postulate uh, in the same year to tell that this is not the correct one. So first it was realized that the organism that are found as a part of normal bacterial flora may act as a pathogen under certain other conditions when the conditions are deleterious. These condition organism microorganisms may be altered or increased significantly in numbers relative to other non-pathologic species to function as pathogens. This type of bacterial pathogen is referred to as an endogenous pathogen, in contrast to an organism that is not normally found in the healthy states, which is termed as exogenous pathogen. Thus, the current concept of process involved in the development of periodontal disease falls under the specific plaque hypothesis. So, in short, it states that the disease results from the action of one or more several specific pathogenic species and is often associated with a relative increase in the number of microorganisms. So, if a bacterium has to satisfy the criteria for it to become a periodontal pathogen, it has to satisfy these five criteria: association, elimination, host response, virulence factors, and animal studies. So based on Socrates' criteria, these two bacteria have fully filled in the criteria for the particular disease. For example, the A. comitans bacteria has been found to be the agent of aggressive periodontitis, and Porphyromonas gingivitis has been found to be the agent of chronic periodontitis disease causing. So there were lots of confusions regarding this non-specific plaque hypothesis and specific plaque hypothesis. So ecological plaque hypothesis was taken into play next. So the key features is that the selection of pathogenic microorganisms is directly coupled to the changes in the environment. Diseases need not have specific etiology, and any species with relevant traits can contribute to the disease process. So in other words, the key element of ecological plaque hypothesis is that the disease can be prevented not only by targeting the putative pathogens directly, but you can also use antimicrobials, anti-adhesive strategies, and also by interfering them with selection pressures responsible for their enrichment. Ecological flora from gram positive to gram negative microorganisms resulting in the disease. So coming on to the pathogenesis of periodontitis. So generally, the microbes when they first start challenging the host with the help of the antigens and the polysaccharides of the bacteria, the host responds back with the help of antibody or the neutrophils. the host also gives around cytokines, prostanoids, and matrix petalloproteinases. But when this balance is disrupted, then you have the connective tissue damage as well as the bone metabolism gets altered, and this results in clinical signs of disease, initiation, and progress. So this is a two-way relationship. So microbial challenge is present, there is going to be clinical signs of disease initiation and progression. So coming on to the benefits of the dental plaque, they play a major role in the normal development of the physiology of host in mineralization of the early carious lesion. It acts as a barrier to colonization by exogenous species termed colonization resistance. Now, coming on to the fact plaque as a biofilm, according to your topic, biofilm is a well organized cooperating community of microorganisms. They form under fluid conditions. Bacteria in biofilms produce compounds that the same bacteria do not produce in the cultures. The matrix is surrounded by the colonies that act as protective barrier. Biofilm bacteria are often 1,000 times more resistant to antimicrobial agents than their planktonic counterparts. So, how can you tell that a particular agent, like for example, plaque is a biofilm? It should satisfy these following properties. That is, microorganisms are arranged in in microcolonies. Yes, plaque does this. Microorganisms are surrounded by protective matrix within the micromolecules. Are from the differing environment. Microorganisms have a primitive communication system which is known as quorum sensing, and they are resistant to antibiotics, antimicrobials, and host response. So, if it satisfies all these categories, then we consider that agent to be a biofilm.